Thank you for watching Beaufort County Schools Mental Health Family Forum. Because of the sensitivity of this topic, this forum was pre-recorded. The experts from Beaufort County Schools and Family Wellness will answer the questions posted by our stakeholders on the forum on Beaufort County Schools homepage. Our first expert is Renee Boyd. Ms. Boyd has been a leader in Beaufort County Schools in multiple positions and is currently the director of Project Aware, an inspiring Beaufort County Schools program. Thank you, Renee Boyd.
Thank you for having me. Beaufort County Schools was selected as a Project Aware site in 2018. And the goal of Project Aware is to develop a comprehensive plan of activities, services, and strategies for connecting youth and families to mental health services. Recognizing the interrelationship of academic outcomes and mental health well-being of students, Project Aware seeks to provide an embedded approach within an existing system versus fragmented and reactive approaches. Project Aware fits nicely into the work we are doing with the multi-tiered system of support framework. During the last 3 years, we have worked diligently to build an infrastructure to provide a full continuum of services around mental health. We have worked to ensure that our students have available to them mental health services at the core, supplemental, and intensive levels. We've also purchased programs to assist with promotion and prevention of mental health services. After completing a needs assessment of the mental health services here in Beaufort County, we acknowledged that we had to improve in providing services. We also added social workers and school counselors to help with that. Before we added these counselors, our social workers were primarily doing attendance. Now they're actually being able to provide individual and group therapy. We continue to put these services in the school to add to our toolbox, and our school counselors and school social workers are a valuable resource with mental health services here in Beaufort County. Another service that we are proud to be able to provide is school-based therapy.
Okay. And with that, I am so excited that I have the privilege of introducing Dr. Bell. Dr. Bell is the owner of Family Wellness Center. We have a memorandum of understanding with Family Wellness Center to provide services to our students. Dr. Bell is also responsible for making it possible for Beaufort County Schools to utilize telemed for some of our students to be able to see a psychiatrist without having to leave Beaufort County. Thank you, Dr. Bell, for being with us today.
Good morning.
And Dr. Bell, can you give us a little history of school-based services in Beaufort County Schools?
Sure. We've been providing school-based services now for 10 years in Beaufort County Schools.
Okay. So how does a child receive services?
We typically go through the school counselors, and they send a referral to us after getting parental consent, and we contact the parent and set it up at the school.
Okay. If a parent, if they saw a need, could they contact you directly, or how would that work if they wanted to receive services?
They could, and then we would pursue getting appropriate consents and releases to communicate with the school.
How many therapists work with Beaufort County Schools?
Right now we have 3, which includes myself.
Okay, fantastic.
And that's Rebecca Scahill and Dr. Jason Perry.
Okay.
And they've been with the practice now for 6 years.
Oh, that's a great continuum of service. That's fantastic. So what does it look like when you serve a Beaufort County school student?
So initially we set up a meeting with the parent and the child at the school, and we go over concerns, history, medical, and then we establish some goals and a process to meet thereafter. So we may meet weekly or every other week or so at the school.
There's also been a lot of questions about suicide and signs of suicide. What should families look for? What are some signs of suicide?
It's important to know that it's not always possible to know when someone's going to commit suicide, but some signs that we do know of are going to be writing or talking about suicide, researching or viewing social media about death or suicide, self-harming behaviors such as cutting, which may be on the arms or the legs, depressed mood, especially if it's been persistent for more than a few weeks or so, isolating from family and friends, and then out of character type behaviors, giving away possessions, saying goodbye to family or goodbye to friends, or risky behaviors such as substance abuse.
Okay. All right. Thank you. And are there any other risk factors or triggers that families can look at when they might need mental health services?
Yeah. Certainly, if there is a concern for suicide or safety, access to means is a major risk. So, any weapons or medication should probably be eliminated from the equation. A significant breakup or bullying at school could be a risk factor. Loss of family members, close friends, even parental conflict and divorce. Um, Also, like a perception from a student as a failure, which may be related to school, family, and any child abuse or neglect would be a risk factor.
All right. Well, thank you. And if a step notices any of these warning signs, should they do?
Um, if noticing any of the signs of suicide, the parent should first try to have an open conversation with the student, with the child. Um, Try to go with a sense of understanding, and really just trying to find out what is going on from their perspective, and ask directly if they're having any suicidal thoughts. If there is if the parent believes there's an imminent risk for safety, they should probably pursue a crisis consult immediately.
All right, thank you. And peers, if a young man or young woman is afraid or worried about their peers, what are some things that they can do?
Again, talk to their friend. Try to have an open conversation and express support, but encourage them to talk to a professional or a trusted adult, and then try not to assume a counselor role with your friend, but certainly tell someone. So for a friend to go and talk with someone like a counselor, parent, pastor, someone, let them know what's going on with the other friend that might be having suicidal type thoughts. So, but never dismiss it.
Thank you, Dr. Bell. And you can see why this is such a great relationship that we have with family wellness in our school system. I mean, we can't talk about the numbers, but you've helped so many students. So we really do appreciate it. So now we're also going to bring up someone else, Erin Rawls, who's a mental health liaison for Beaufort County Schools. She works with family wellness and with Renee and all our systems as that mental health liaison. And Erin, what is your role as a mental health liaison?
Assisting with crisis situations at any of the schools in Beaufort County, conducting crisis evaluations, if they arise, and helping the student kind of plan for and take action, just depending on the situation. Assisting with suicide crisis response, grief counseling, things like that as it's needed, throughout the schools. Facilitating and supporting counselors and intake meetings if a child is returning from a psychiatric facility or from a suicidal ideation or attempt, something like that. I monitor the referrals that we get from the counselors for the Family Wellness Center, so making sure that they've got everything that they need, making sure they get to the Family Wellness Center and that process goes smoothly. I also can provide therapy to students in Beaufort County schools that may not have insurance or may have a private insurance that has a really high copay that
really helpful.
Some parents might not be able to afford. I can link students to outside community mental health agencies if school-based just isn't working or isn't an option at the time, things like that. And just also adding an extra layer of support, like was mentioned previously, to the school counselors, if they're ever feeling stuck or need assistance in something.
That's huge. That's comprehensive. So what are some common mental health diagnoses that we see in school-age children?
Sure. Some of the most common mental health diagnoses that we've seen in school-age children, definitely anxiety, whether it be something specific like test anxiety or social, or just something more generalized. They can just have anxiety about anything and everything. ADHD, and ADD, that attention deficit hyperactivity disorder, depression, other mood disorders, bipolar, schizophrenia, PTSD, so that trauma-specific disorder, and then eating disorders are also common in school-age children, as well as conduct disorders.
Thank you. So there's been a lot of question about social media. Does social media play a part in mental health? And as a family, what are some healthy practices that have been put in place for children with social media?
Absolutely. Social media can play a huge role in a child's mental health and well-being, and it can especially fuel some anxiety and depression in the children as well. While there may be some positive attributes to a child being on social media, there are also some negative ones that could, come along with it. And while social media isn't completely avoidable, in today's world, there are definitely some things that parents can do to kind of limit and make it a more safe practice. Things like parental controls on devices, limiting time use that, the child can be on the social media, whether it be, before or after school. Having device-free times of the day, so like homework times, you can't have your phone out. At dinner time, we can't have our phone out. Things like that, so that they're getting some time away from the phone, the device, and the social media. Definitely, teach your children that not everything you see on social media is, a real life depiction of some, people's lives. Discuss with your children what's appropriate to put on social media and what's not appropriate. Definitely encourage not to add any strangers, have some privacy settings and things like that, so that, while they might be on social media, the time's limited and it's a little bit safer.
That's great advice. Thank you, Erin. So why might a student, going back to the referral process, what might a student be referred for a mental health evaluation or counseling?
So there are many different things. It could be a combination or just one or two. Definitely persistent feelings of sadness, hopelessness, and helplessness. Persistent feelings of worry, anxiety, fear. Feeling angry towards everybody, lashing out, things like that. Getting easily mad and frustrated. Feeling that, you're kind of out of control, losing your mind type feeling. Loss of interest in things that, you once really enjoyed. So, just kind of pulling away from stuff that you usually like doing. Sudden unexplained drop in grades at school is a big one. Major changes in sleeping and eating patterns and habits. Often being alone and isolated from friends and family. Being rejected by others or bullied is another big one. Experiencing panic attacks in social situations, dealing with great loss or grief is another big one. Reoccurring nightmares, alcohol and drug use, those risky behaviors that were mentioned before, and then, definitely expressing thoughts of self-harm, suicide, and then just any change that you might consider major or out of the norm for the child.
Okay. That's really great to think about. Thank you. So what is the biggest barrier you see? We have all the support. What's the biggest barrier seen in regards to accessing school-based therapy?
So right now, the biggest barrier that we're seeing is getting consent from parents and guardians for the actual service. So the counselors and the therapists can't actually serve the student without getting that consent and having that intake meeting that was previously discussed with the parent and guardian. So making sure that, they're getting on board and they're attending these meetings and signing off on all the required paperwork and consents to actually get the service started.
Thank you so much, Erin. That was a lot of good information. So another important layer of student support that we've talked about today is that school counselors. So school counselors, they promote student success. They provide preventative services, they respond to identified student needs, and they implement a comprehensive school counseling program. And these programs do address academic career, but include that personal and social development for all students. Our counselors sometimes work with small groups and individual scheduled student meetings. They also work with staff on how to support their students. And obviously, our school counselors work hand in hand with the mental health partners that you met today. There are also a few other services that our stakeholders asked about. They asked how they could help students with bullying and what to do if there's a crisis situation. So if your child is having trouble with bullying, harassment, and it could be in the form of racism or any other kind of bullying situation, there are multiple ways to report it and to work with the school. First, the student can go directly to their teacher. They can go directly to their school counselor or their administrator. If they are uncomfortable with that, they want to remain anonymous, we actually have an anonymous bullying hotline. It's 252-940-6545. And that you leave a message anonymously. Of course, you would need to leave some details, the school, the age of the student who is doing the bullying, and that is sent to the school for research. There's also an anonymous link on our Beaufort County Schools webpage where you can report bullying. We also use a service called Gaggle. Our students know that we use this, which reads incoming and outgoing emails, student work, and searches that students do while they're on our devices or on our internet. We have found students that will actually write to the people reading Gaggle resources, and they'll say, hey, there was a problem at school today, I'm feeling bullied, and this is what happens. And it's another way of reporting bullying. And we've actually been able to do some really good research and to take care of those situations for the students. In the first 2 weeks of November, the November 6th through 13th, our students in middle school and high school will be trained in Say Something. Say Something is an anonymous reporting app and also with a phone number that students can call and report bullying and life safety situations. Now, if there is a mobile crisis, or if you feel like there is a crisis at your home and you're really worried immediately about suicide or self-harm, you could call 911, or you can also call the mobile crisis phone number. The mobile crisis phone number is 1-866-437-1821. Or there is a chat box. If you Google Mobile Crisis Beaufort County, you'll find it. And with that, anyone has access. It's 24 hours a day, 7 days a week. And crisis intervention services are provided in any location. That means they can come to your house, they can come to the school, they can go to a restaurant, or they can go to a store if that is where the mobile crisis is that's where the crisis is occurring. And that is a service in Beaufort County. So I want to thank you and everyone who was here today for watching this Beaufort County Schools Family Forum on Mental Health. If you want to know anything else about the mental health supports in Beaufort County Schools, please call Renee Boyd, Director of Project Aware, at 252-946-6593, 252-946-6593. Our family forums are a community outreach initiative of Beaufort County Schools. We are going to have some future family forum topics that will include high school graduation and registration opportunities, internet safety, curriculum, academics, AIG, EC 504 support. With all good wishes.